Hello.
My name's Julie. I'm going to be your nurse today. Can you tell me your full name and date of birth?
My name is Luis Torres. My date of birth is 9/12/16.
Okay. So today with Lewis, I'm going to be performing a heart, lungs, and musculoskeletal assessment. So to start, I will start by palpating his carotid artery. So I'm just going to have him turn to the left, and if you see down here, his carotid artery kind of runs along the muscle here. So I'm just going to palpate on each side, making sure they're symmetric. I'm feeling for any thrills, which is like a turbulent or it'll be like a turbulence that you feel in palpation, which everything feels normal. So then I'm going to listen and see if I hear any bruits, which are like a swooshing sound. I'm going to be using the bell of my stethoscope, or the diaphragm of my stethoscope, and I'll just listen on each side. Which everything sounds normal. So next I'm going to palpate the pericardium. So I'm going to start down by the apical, where the apical pulse is located. So I'm just going to feel, and this is where the point of maximum impulse is felt. But on Lewis I won't be able to feel it because he's wearing clothing. So after palpating there, you'll move up to the left lateral border and just palpate. And then you'll move up to where the aortic valve is located at the second intercostal space, which everything feels normal. Next I'm going to auscultate on the 5 points. So first I'm going to start by using the diaphragm of the stethoscope, and as I move to each spot I will name each of them. So first I'm going to come down to the second intercostal space. This is where the aortic valve is located, and I'm just going to listen. And then I'll move across on the left side to the second intercostal space, and this is the pulmonic valve. And I'll move down to the third intercostal space. This is called Erb's point. And then down again to the fourth intercostal space, which is where the tricuspid valve is located. And then across to the midclavicular line, down to the fifth intercostal space, which is where the apical pulse is felt. And that's the mitral valve. And then I'm going to turn my stethoscope to the bell side, and I'm just going to go through and listen to each point again. It's also important to note when you're listening at each point that S2 will best be heard at the aortic valve, or the base of the heart, and S1 will be best heard at the mitral valve, which is the apex of the heart. For the final part of the heart assessment, I'll be listening at the mitral valve to see if I can hear any murmurs. To do this, I'm going to need to put Lewis in the left lateral position. So I'm going to have you go ahead and lift your left arm up above your head, and then go ahead and lay on your left side. By putting Lewis in this position, it brings the heart closer to the chest wall, and it makes it easier for me to be able to hear the mitral valve. So using the bell of my stethoscope, I'm going to listen at the fifth intercostal space. After listening, I do not hear any murmurs present. You can go ahead and lay back flat. So next I'm going to move on and assess his lungs and thorax. So first I'm just going to start by inspecting, just watch and breathe. A normal respiratory rate is anywhere from 12 to 20 breaths per minute. I want to see his rhythm. Is it regular or irregular? The depth of his breathing. Is he breathing shallow or deep or just normal? Which in this case, he's just breathing normally and regularly. So he's not in any distress. He's not using any accessory muscles to get breaths. And I want to look at the shape from the front and from the side, and is everything symmetric? So then I'm going to have the patient stand up and turn around, and I'm going to show respiratory excursion. So I'm just going to kind of place my hands here, and I'm going to have him take a deep breath in, and you see my hands moving out, and then when he comes back in, they go back in as well. Next, I'm going to do the tactile affirmatus. So with that, I'm going to use the ulnar aspect of my hands, and every time you feel my hands on your back, just say the word 99. And when he says that, I should feel vibrations.
99, 99, 99, 99, 99.
And then next I'm going to percuss posteriorly. So I'm just going to take my hand and start at the top and just kind of palpate down. And I should hear like a resonance. Unless I hit a rib, it'll be a dull sound. And you want to do the same thing on the other side as well. Okay, so you can sit back down, Lewis. And now I'm going to listen to his lungs. So I'm going to use the diaphragm of my stethoscope. And I'm just going to kind of listen in a ladder pattern. So I'll start up by the clavicle or even above, and up here is where you'll hear bronchial sounds. So just take a deep breath in every time you feel my stethoscope move. And then I'm going to have him stand up, and I'm going to listen posteriorly as well. So every time you feel my stethoscope, just take a deep breath in. And as I'm listening, I just want to hear if there's any wheezing or rales or stridor, and just note any abnormalities in his breathing. So next I'm going to perform agophony. So this is just listening to his lungs with the stethoscope. You would just position your stethoscope the same places that you would listen, and every time you hear my stethoscope, just say the word E. and I should be able to hear the word E in my stethoscope. If it was abnormal, I would hear like an A instead of an E.
E, 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 E.
And they were all E sounds, so that is normal. When you're listening to breath sounds, it's important to note the bronchial will be heard above the trachea, which is up in this area. And then the bronchiovesicular will be heard in the mid-chest area and on the top of the back. And then all the periphery, which is down below on the sides, that is the vesicular breath sounds. Next, I'm going to move on to the musculoskeletal system assessment. So I'm going to start with his upper extremities. For the purpose of this video, I'm just going to focus on his shoulder joint. So I'm just going to palpate both sides, seeing if there's any deformities in his joints, any crepitus, which they both feel normal. So I'm just going to have him watch me and do what I do. So I'm just going to have him lift his arms up and put them all the way back behind you, and then lift them up, all the way up, and then just put them back down by your sides. And then I'm just going to put my hands on your shoulder and just try and push up to meet my resistance.
Okay.
Which he does both. Okay, next we're going to move to the lower extremities, and again, for the purpose of this video, we're just going to use the hip joints. So I want to just inspect and palpate on both sides, seeing if there's any deformities or crepitus in the hips at all. Have you ever had any problems with your hips?
No.
Okay, so now I'm going to test his range of motion and his muscle strength. So I'm just going to ask that he just repeat what I do. So just kind of lift your leg, you can use that leg, just lift it out, and back in, and pick up, and then lift your knee up. And he has really bad balance. And then put your leg back behind you, and then just back to normal. And then I'm just going to put pressure against his leg and just ask that he push out against me to test his strength, which is good. Next, I'm going to inspect Lewis's spine, so I'm going to have him turn around. And I'm just going to start at the top and palpate down his spinal column, checking to see if there's any scoliosis, making sure if everything's in line, which everything is straight and normal. So then I'm going to have him turn to the side and bend forward. And as you see when he's bending forward, it's a C curvature of the spine. And again, I just want to feel from the top all the way to the back, which everything is normal. Then I'm going to have Lewis stand back up straight for me, and I'm going to test his range of motion of the spine. So I'm going to have him turn, and I'm going to see if I'm going to hold his hips in place and just ask that he move from side to side without moving his hips back and forth. So go ahead. Which he is able to do normally. Along with the musculoskeletal system assessment, there are also some neurosensory components to touch on. So first I'm going to start with the Romberg test. So I'm just going to have Lewis stand here and close your eyes and just stand there. And I'm going to note if there's any swaying at all. If he were to sway, which he's not, and he appears to be standing straight, there would be a cerebellar dysfunction. Okay, you can open your eyes now. So next I'm going to have Lewis walk across the room to inspect his gait and posture. So if you want to walk across the room and just watching his gait and his posture, and then on the way back do a heel toe walk. Good. Okay, you can go ahead and sit back down. Next we're going to do light touch to see if he can pick up on where he's being touched. So you want to use an object and just lightly touch different areas and then see if Lewis can name them. So I need you to close your eyes.
My inner arm, my forearm, forearm, my shoulder, my chin.
Okay, you can open it. And he was able to name all the spots that I touched him with the Q-tip. Next is coordination. So I'm just going to have him hold his hands up, and you're just going to repeat. You're touching your thumbs to each of your fingers, just back and forth with coordination, which he's able to do with ease. Okay? And then the next test is for tactile discrimination. There are 2 different tests that you can perform, but I'm going to do stereognosis. So with that, I'm just going to have Lewis open his palm up and he'll close his eyes. And then I'm just going to put an object in his hand and he should be able to name what that object is.
The key.
And Lewis was able to do that. That ends my assessment on the heart, lungs, and musculoskeletal system. Thank you for being my patient today.
Thank you.